Good day everyone. Today we will be presenting on understanding and preventing cervical cancer. We will follow a structured approach covering 5 key sessions: theme and significance, main arguments, explanation and analysis, solution or recommendations, and reference.
Our topic is cervical cancer, a preventable but still deadly disease affecting women worldwide. Well, why is it important? Cervical cancer is the fourth most common cancer among women globally, with over 600,000 new cases and 340,000 deaths each year. Most cases occur in low and middle income countries, mainly due to low screening and vaccination rates. What makes the topic critical is that nearly all cervical cancer cases can be prevented through early detection and HPV vaccination. Therefore, cervical cancer is not only a medical issue but also a matter of women's health, equity, education, and access to preventive care.
And here are the key points of our presentation. First, cervical cancer is largely preventable through HPV vaccination and regularly screening. The HPV vaccine protects against the main virus types that cause it. Second, HPV infection is the main cause of cervical cancer, yet public awareness remains low. Third, early detection and treatment greatly improve survival rates. Early-stage cases are often curable. Finally, there is an urgent need for better education, accessible screening, and vaccination programs. Governments and health organizations must work together to make prevention available to all women.
And now let's look at some common treatment methods for cervical cancer. First, there is hysterectomy. This means removing the uterus through surgery. It's one of the most common treatments for women in the early stages of cervical cancer. And secondly, we have radiation therapy. This treatment uses high energy rays to destroy cancer cells and control the tumor in a specific area. And third, there is chemotherapy. It uses powerful drugs to kill or slow down the growth of cancer cells throughout the body. And finally, targeted therapy or immunotherapy. These are newer treatment options that either attack specific cancer cells or help the immune system fight cancer more effectively. Each of these methods is important, depending on the stage and condition of the patient. However, while treatment is important, prevention is even more crucial. So what can we do to reduce the risk of cervical cancer and move toward its elimination? First, we can start with public health education. We should raise awareness about HPV and cervical cancer through schools, community programs, and the media. For example, public campaigns in Taiwan often use slogans like 6 minutes to save your life to remind people that pap smear screening is quick, simple, and effective. Encouraging open conversation about sexual health can also help reduce stigma and make more people willing to get screened or vaccinated. Second, we should promote widespread HPV vaccination. The HPV vaccine should be affordable or free for both girls and boys. Governments can include HPV vaccine in national immunization programs so that young people can be protected before they are exposed to the virus. And third, we need to make screening programs more accessible. Free or low-cost pap smears and HPV tests should be available to everyone. For example, government-funded screening programs for certain age groups are a great way to help with early detection. Mobile clinics can also reach women in rural or remote areas who might otherwise miss the chance to get tested. And finally, global cooperation is essential. We should support the World Health Organization's several cancer elimination strategies which aims for 3 goals. 1. 90% of girls fully vaccinated with HPV vaccine by age 15. And second, 70% of women screened by age 35 and again by 45. And thirdly, 90% of women with cervical disease receiving proper treatment.
By taking these steps, we can move closer to a future where cervical cancer becomes a preventable and even eliminable disease.
Causes and risk factors. HPV infection is responsible for more than 99% of cervical cancer cases. HPV is a common sexually transmitted infection. Most sexually active people will get it at some point, but resistant infection with high-risk HPV types, such as HPV 16 and 18, can lead to cancer. Other risk factors including multiple sexual partners and unsafe sex, which increase the likelihood of acquiring HPV. And second, smoking, which can weaken the immune system. And the last one, the lack of regular screening, protection and early detection. HPV vaccination. Vaccines protect against high-risk HPV types. WHO recommends vaccination for girls aged 9 to 14 before becoming sexually active. Screening tests. Pap smear detects precancerous changes in the cervix. HPV test detect high-risk HPV infection. Combining vaccination and screening can protect up to 90% of cervical cancers. In high-income countries, organized screening programs have drastically reduced cervical cancer rates. However, in low-resource settings, limited access to healthcare, social stigma, and lack of awareness lead to a late diagnosis and higher mortality. This is the issue we should address and focus on.
Here are our work assignment. Here are our reference. Thank you for listening.